Breast cancer develops when normal breast cells change and grow in an abnormal and uncontrolled way. These abnormal cells can form a lump or a tumour in your breast. It can usually be treated successfully if it is found early. Breast cancer is the second most common cancer in Ireland after skin cancer. Most breast cancers occur in women who are over the age of 50, but younger women can get it too. Men can also get breast cancer, but this is rare. Spotting cancer early is important. Look for any symptoms or changes in your breast that are unusual for you. Symptoms may include a lump or thickening in your breast or your armpit, a change in the size or shape of one breast, a change in the skin of your breast, like puckering or dimpling. You may have a breast abscess or infected boil, or a change in your nipple, like a pulled in, sunken or flattened nipple. You may have an unusual discharge from your nipple, a change on or around the nipple, like a rash or flaky or crusted skin, or swelling in your armpit or around your collarbone. Breast pain alone is not usually a symptom of breast cancer. If you notice a symptom or change in your breast, it is important to get it checked with your doctor. Your doctor will examine you and may refer you to a breast clinic where you may have a triple assessment. This means that you may have a physical examination, a mammogram, which is an X-ray of your breast, and/or an ultrasound scan, which is a scan to see if there are any lumps in your breast. You may also have a biopsy, which involves taking some cells from the breast tissue and looking at them under a microscope to see if they are cancerous or not. The two main types of breast cancer are non-invasive breast cancer and invasive breast cancer. Non-invasive breast cancer is when the cancer cells have formed inside the milk ducts but have not spread outside them. Invasive breast cancer means that cancer cells have moved beyond the lining of the milk ducts, invading the surrounding breast tissue, and may have spread outside the breast to the lymph nodes and other parts of the body. This is the most common type of breast cancer. If you are diagnosed with breast cancer, you may have surgery to remove the tumour. This could be removal of the lump, called a lumpectomy, or removal of the whole breast, called a mastectomy. Chemotherapy, which are drugs to cure or control the cancer. Radiotherapy, which uses high energy rays to kill cancer cells. Targeted therapies, which are drugs that target certain parts of breast cancer cells. Hormone therapy, which works by blocking the effects of the hormone estrogen on the breast cancer cells. Sometimes a combination of these treatments is given to treat breast cancer. Many breast cancers can be cured or controlled, and fortunately, research and science are improving outcomes for breast cancer all the time. Breast changes don't always mean cancer, but it is important to check your breasts regularly. For example, once a month, no matter what age you are. It is important to know what is normal for you. You should know how your breasts look and feel. Stand in front of a mirror with your arms by your side and then above your head and inspect your breasts. Look for skin changes like dimpling or puckering. Look for changes to the shape or size of your breast and nipple. Feel your breasts. Start from the nipple and move clockwise until you've covered the whole breast, armpit and collarbone. Your left and right breasts are rarely identical, so know what is normal for you. We don't know exactly what causes many cancers, but there are things that can increase your risk of getting breast cancer. Our risk of breast cancer increases as we get older, and having a family history of breast cancer is also a risk factor. A change in certain genes can increase your risk of breast cancer. For example, the BRCA1 and BRCA2 genes. Around 5 to 10% of breast cancers are linked to gene changes. Lifestyle factors such as drinking alcohol, not being active, being overweight, and smoking or using tobacco products may increase your risk. There are simple lifestyle steps that we can take to reduce our risk of breast cancer. Be a healthy weight. Stop or limit your alcohol intake. Be active with regular exercise. Don't smoke, and get screened. Screening is testing for cancer when you have no symptoms. BreastCheck is the National Breast Cancer Screening Programme. All women and people assigned female at birth, aged 50 to 69, are invited to have a free mammogram every 2 years. Screening helps to detect breast cancer at an early stage when there is a much better chance of treating it successfully. If you are younger than 50 or older than 69, you should continue to be breast aware. You should continue to check your breasts regularly. Always get any symptom checked with your doctor, even if you have recently had a screening test or are due for one soon. Spotting cancer early is important. Learn what to look for and check your body for changes. Talk to your doctor if you notice anything unusual for you. For more information about breast cancer, go to our website cancer.ie/breast. You can also call our support line free of charge and talk to one of our cancer nurses on 1800 200 700. Or you can email our cancer nurses on the support line at supportline@irishcancer.ie.